Time Alone, man. So that's from Bien. Saw him doing an interview at Kiss UK. Definitely working the album. That's one of the things I've actually been saying, right? When you have a project as good as this, you gotta make time and, go do all of these interviews, go to different markets where they don't know you, go to like markets where they know you. So it's been a very good rollout. He was in Rwanda, he's been in Uganda, now the UK, Kenya as well. So that's a very, very good way to walk a record. All right here on Fast with the Hits, Trace FM, we're about to get into a very, very important conversation. A conversation that, to me, I definitely need to know everything about, because I've got enough friends who have hard suffer. They've told me about the condition, so I know enough people who've suffered from endometriosis. Also because I've got a daughter who's young, who's 10 years old, and she's about to get into pre-teens and into her teenage years. And with that comes her getting into her cycle. So as a man, I need to know all of the information, right? It's crazy that I mentioned that she went for something called a red party the other day, and I was like, what is a red party? And I was just like, so her mother had to tell me, oh, this is when they're taught this. And her mom was like, she's very shy about those things. Yeah. But I digress. I've got Dr. Yamal Partel, who's a specialist. He's going to tell us he's a specialist in what particular field. And I've got a friend of mine called Wathanu Warui. I never call her that. I call her STL. So when guys are Wathanu, I'm like, who's that? But welcome to the studio, guys. Good morning.
Good morning to you.
All right, move a bit closer to the microphone. Let's push them a bit closer so that guys can hear you very well. All right, so that like that. All right, let's do that again. Good morning, guys. How are you?
Good morning to you.
Good morning, Calvin.
Pleasure to have you guys in the studio. Sorry to wake you guys up so early, but I bet you guys are early risers.
Yes, we are. Yes, I am.
The doc as well.
Yeah.
What time are you up? 4 a.m.?
I'm out of the house by 5:30 every day.
5:30?
Yes.
Damn, you're beating me. well, the boss knows I get here at 5 a.m., but maybe occasionally. But I'm glad that we're in the studio, and I want us to talk about endometriosis. Here's the thing, right? So I've kind of dealt with it, right? I've had enough friends. We even had a colleague over here who's an endo warrior previously, right? And one of the things that I've come to learn is the pain. But I think besides that, I've now gotten to learn a bit more, but I know a lot of people don't know what exactly endometriosis is, for starters, right? So, Doc, I think it would be appropriate for us to start with you, for you to give the breakdown on what endometriosis actually is.
Thank you very much, Calvin. It's a pleasure being here today with Stella and you. My name is Dr. Yamal Partel. I'm a consultant obstetrician gynecologist and a specialist in minimally invasive surgery and endometriosis.
Yes.
Endometriosis is a very unique disease. It is where you get endometrium, which is the lining of the uterus, the one that sheds and grows and sheds every month.
Yes.
So it's the lining-like tissue growing outside the uterine cavity, outside the uterus. So it could grow anywhere outside the uterus. It grows mainly in the pelvis area.
Yes.
But it has been found to be in the brain, in the eye, in the umbilicus, in the lungs. So it can grow basically anywhere. So that is, in essence, definition of endometriosis.
So when you say it can grow anywhere, you just mentioned the brain, the eye, all of that. So is this for men and women, or specifically for women?
Well, majority of the time it is women's disease because they have the endometrium, but they have been found of some issues in some of these unique cases as well.
Yes, unique cases. All right, so there you have it. That's the definition right there. But I want to get into it, right? So is there a specific cause for this?
Endometriosis is a very unique disease in the sense that it's called even a disease of theories. So what we mean is there's so many theories postulated as to why a woman or why a girl should get endometriosis. None of them answer all the questions. So there are some theories that explain because of some retrograde or backward menstruation, some issues related to tissue injury and repair, some are issues related related to immunologic, some have a genetic component to it. So basically, there are very many different theories postulated, and none of them actually suffice to answer all the scenarios that are possible around it.
Wow. When you said genetic, I was like, wow, this is very, very interesting stuff. Now I want to talk to Stella, right? So we've had this conversation, and I was watching an interview that you gave. So this has been something that has been with you from the pain started in high school, right?
Yeah.
But you got your period rather early, at about the age of 11.
Yes.
And the pain now comes in very numbing in high school, and in high school, I think, having gone through 844 and everything, you can imagine how people they don't even know. So what they don't know kind of scares them. So how was that?
That was crazy.
Yeah.
That was crazy. Just from the time that I started my menses, as you've said, it was quite early.
Yes.
And then through high school, that's when now pain became so numbing. Like I couldn't be in class when I was on my periods. And then at the time, I was not getting the right diagnosis or the right treatment. And it's excuse me, it's unfortunate that I was later diagnosed by Dr. Yamal, actually in 2017, after high school and after campus, after going through a number of specialists who still were not able to tell me what my issue was. And then getting to Dr. Yamal, who then finally had a name to this thing that had really changed my life or affected the quality of life that I was having. It was quite a relief for me. As much as it was sad, it was a relief because we actually had a name on what was ailing me.
What was going on?
Yeah.
So you've gone to all of these specialists who've not given you a name and everything.
Yeah.
And at this particular point, we've got Google, WebMD, and all of that. Is this like, are you feeling like these guys are missing it every single time and you don't want to tell them, but you've kind of read? Were you going through something like that?
I was going through something like that. And one of the things that even as I am having these interviews and speaking and creating awareness about endometriosis, I'm a really huge believer for self-advocacy.
Yes.
Because half the time as a patient, sometimes you know what you're feeling. The doctor might not exactly know what you're feeling. And I remember at one time even telling a specialist, I feel like before my periods, this pain intensifies and then becomes worse into my periods.
Yes.
And the doctor told me this cannot be related. And because he was the person of authority at that point, I took it. I just let it go. But I feel like had I pushed harder and advocated for myself and what I felt and what I was going through, we probably have gotten a diagnosis sooner. Wow,
because I can imagine the pain through high school all the way up until 2017. Very, very unbearable. While in high school and into, tertiary institutions and all of that, were they accommodative of you, or is it still one of those things they don't understand and they're just like, whatever?
It is a challenge, especially when people are unaware. Then, as you said, people fear what they don't understand.
Yes.
Because if you're saying you can't be in class or you can barely even sit in class, then questions will arise. What is so special about you? Like, I'm a lady, I go through menses every month. What is so special about your case? You're pretending. And from an early age, this does something to your mental headspace.
Yes.
Because you clearly know you're not pretending. Your pain is authentic. It's what you're feeling.
Yeah.
But then other people not understanding that you could be going through that and thinking that you're pretending, it does something to your mental
to your psyche,
space. Yeah.
What about employers? Because I've heard of cases where some employers, I was talking to a lady and they said, oh, my employer doesn't understand this, right? Would you say from your conversations with other endo warriors and also just your friends, is it something that employers understand? Is it part of like some HR policies out there?
I think different employers they're all different.
Yes.
So I'll give you an instance. Even when my previous employer, at that time when I was working in still a financial institution.
Yes.
And my boss at the moment was really understanding of what I was going through. When I called in and said I couldn't come to work, he was very understanding, and that was a man. And then later when my boss changed and it was a female, then things changed, because she was like, I go through periods every month. You can't tell me you can't come to work for 3 days because you're on your period.
Yes.
I don't understand that. Like, do you not want to work? Do you, the same story. So for me, I actually quit my first job because of that.
Yes.
And that was just the time when I finally met Dr. Yamal and was diagnosed. But I had to quit my job to get into a mental headspace where I could now actually just concentrate on finding out what the problem was with me. Yeah.
Now, Doc, I want to go back into that whole, I want to concentrate on what Stella just said. Misdiagnosis, right? It sounds like this is something that happens quite a bit, right? I'm going to put it in the most loose of ways because I'm not a medical professional, but is it something that is not learned, or do you have to have a specialism for you to actually get it? It's not, like a general practitioner wouldn't be able to get it, or what's the case?
So let's put it this way. It's not misdiagnosis, but it's a very misunderstood disease.
Okay.
Because it's very complex. And there are very many, what we call differential diagnosis to this kind of situations.
Yeah.
So differentials are the things that are likely to behave the same way. And until recently, and I would say probably until the last 10 years ago, there were even some of our senior colleagues who used to tell us that there's no endometriosis in Africa. All right. And the reason was like, oh no, we see more of it as infections. So we come up with a diagnosis of endometriosis and they say, no, this is PID, this is infection. So there were those kind of scenarios. Now, this is a scenario world over. It's not a Kenyan thing. It's not an African thing. The average diagnosis time from initial presentation to a clinic or to a center for help for such a scenario to diagnosis made on average is 7 to 10 years worldwide.
7 to 10 years.
7 to 10 years. So you see, it's very okay for that to have happened. But with creation of awareness, education, I think today the endometriosis department and field has advanced so much that diagnosis can be made earlier. We now have people who are now considered endometriosis experts. We have now centers that are called endometriosis centers of excellence. So when you now reach such a place, then your diagnosis interval automatically shortens.
Yes.
So we're now picking up these women much earlier than has been till now.
So when we say much earlier, what ages are we looking at? 20s, teens?
So endometriosis, again, is a disease that doesn't have a limitation to what age it affects. Yes, we would say that its initial presentation would be once the first periods begin.
Yeah.
So that is still very early, 11, 12, 13,
Yeah.
and in the teen years. So we get endometriosis right in the teens. We do get women even after menopause who sometimes still have endometriosis because there's some sort of hormones that are still produced by these endometriotic lesions, and it continues. So the myth that it can never happen in a woman postmenopausal is also not exactly true.
Yes.
It's rare, yes. It slows down, yes, but it may still persist. So the majority is in the reproductive age group. But we do see teens, we do see elderly postmenopausal women with it too.
Interesting. If you're just locking in, of course, we gave the definition, spoke about at what age it can start, all of the different facets of it. And now I want to focus on the bit to do with mental health, because I think this is definitely something that's unspoken. And, there's so many forms of... so many things that can destabilize your mental fortitude, right? And this definitely sounds like one of them, right? So, Doc, I'll start with you, right? So, is this one of the things, would you say that there's a high chance that if you are battling endometriosis, you could kind of fall into depression over time, right? Is it possible? Because you can imagine, just like Stella was saying, here you are trying to explain it to an employer or a teacher, a lecturer, and they're just like, what are you saying? Are you just one of those kids who just doesn't want to, go to class and what have you? Yeah?
So, thanks, Calvin. Let me put it this way. Your question is it possible?
Yeah.
And my answer is, it's not only possible, it almost always happens.
Almost always happens.
Always happens, unless the intervention is done on time. So the main significance, the main consequences of endometriosis on a woman is not only physical, where we are talking of pain related to periods, pain related to sexual intercourse, pain related to passing urine or stool, pain related to breathing if it's in the chest area. So pain issue, pain around ovulation. So that's physical. Then there is the issue of infertility, which is a major component to this disease, and that definitely brings in lots of family issues. So you have challenges with your partner because you're always trying to avoid sexual intercourse.
Yes.
You're trying to not able to still get the child that they are looking for, and it takes time, and that breaks up lots of families as well.
Yeah.
And then obviously the main aspect is the quality of life and the psychosocial. Now this happens to be the most difficult part to deal with, because one, it's not talked about, two, it's not understood, and therefore your workplace, your school place, your college, your family, your friend circle, no one understands. You planned a trip, you planned a party today, and then the next thing is by evening you get a call, no, I'm not going to join you. And no one wants to understand why. Oh, you're a party bummer, you want to spoil everything, we had planned so much. So you see, that really takes you down that whirlhole of going into depression. So it's a very, very likely possibility.
A very likely possibility. Now I'll talk to Stella. We spoke about your employers, right? Have your friends been accommodative? Have they understood, or it took time for, you had to tell them this is how it is, just like the doctor was saying?
I think for me, because it started from quite an early age, I had to develop my own dealing mechanism, which wasn't healthy really, but I keep a very tight circle of friends. And even with that, over time, and also I'd just like to acknowledge that I have very supportive parents and siblings who always come through for me. So that's like my first line of defense, So other than that, I have had friends before who we fell out, because as Dr. Yamal is saying, there are moments when you can plan something for months and everything, but the moment your period checks in or you're about to, then you can't show up. You can't show up, and people don't understand why you're constantly, maybe if something is around the same time every month, then you'll definitely not show up. And then they don't understand why you always have to say it's because of my periods or it's because I'm dealing with this. And then that just wants you to lock people out. You get.
But would you say you've had to really battle with this, with the mental pressures? Have there been times where you were just like, I don't want to talk to anybody, I just want to be by my own, I'm in this cocoon of sorts? Have there been those? So many times.
So many times. That's like part of my life, and it has made me embrace therapy, because there are moments when you can't deal with it alone. You feel like you're going to go crazy. And I also like that Dr. Yamal and what they're doing with Third Park, which is a multidisciplinary institution, where they cover endo from a 360 angle. Like you have the different doctors, including psychiatrists who you can talk to and all that, because you can't handle it alone. You can't handle it alone.
Definitely. Now, Doc, as we progress, right, almost getting to the end, I want to talk about, I was going to say preventative, but that's not the word. What are the procedures? What's the solution for us to to be able to take care of the young girls, the ladies, even women in their older ages who are battling endometriosis?
So one of the things I think is what we're currently doing. And we want to roll this out, more frequently, so that we get to as many as possible. Awareness and education. So get this education going right from the school ages. Even before or just when they begin their periods. Create awareness so that people do not try and normalize pain. That's something that's very important. Our elders and our moms and aunties and sisters should not normalize pain. So try not to tell a girl who is really wincing and curling up in pain that, I think, stop being a sissy. All right, we've been through this, so what's so special? There's something wrong, address it.
Yes.
Third thing is, if you do get diagnosed with endometriosis, I think over time, don't panic, and you're not alone. Over 1 in 10 women worldwide have this. So at the moment, it's over 200 million women worldwide having endometriosis. So you're not alone, and there's always solution to it. The next thing is, you have to understand that pregnancy is something that these people always battle with. They have challenges getting pregnant, and when they do get pregnant, they have challenges during pregnancy as well.
Yes.
So it's very possible to get pregnant. So just seek advice, see the specialists that deal with this, and it's possible. Not all women with endometriosis may need surgery. There are various options available. It could be complementary and alternative medication. It could be exercise and diet. It could be medication that is used, that is hormonal at times, and painkillers as well. And then there is the surgical part of it, which now, brings up the most complexity part of it. But it's possible.
Yes.
So what I'm trying to tell in simple words is, we need to create awareness so that we diminish the time interval between presentation and diagnosis, and then once we pick these girls up early, we manage them early. So in a way, that would be the preventative measure that I would advise.
When it comes to some of these social issues, for lack of a better word, right? And what comes to mind is the Ministry of Education, Ministry of Health, right?
Yes.
Have they are they welcoming of this conversation? Because you can imagine the girls are going through the education system, and we have health. And of course, the government does a lot in terms of reproductive health. Yes. What's the reception been by?
I think there are lots of endo advocates groups now, and support groups. And I know a friend of mine who's now an endo warrior and who actually is a writer, and she's been writing books and that are now being accepted into the curriculum.
Yes.
So they are being involved in the curriculum development, where we are discussing normal menstrual cycle and these abnormalities that come up with it, so that we try and create awareness. And when I say that, I don't mean girls are the only ones who should be going through this knowledge.
Yes.
Boys alike should know what is a menstrual cycle and what it is that is abnormality about it, so that they are also supportive of the scenario.
I like that you've said that boys and girls need to go through it, because I will never forget that very day in primary school where all the girls disappeared on an afternoon, and I was like, where did the girls go? And they came back with they'd been given tampons and the pads and everything, and we're like, oh, but had we been involved right now, I know so much more. But thank you very much, Doc, for coming through. But before we even exit, right, could you tell us about the hospital, the name once again, and what you guys specialize in, so that guys we can all know?
Yes. So what we mean about endometriosis related treatment and centers is, ideally it should be multidisciplinary. So multidisciplinary in endometriosis would mean a specialist gynecologist who is able to diagnose and treat it in totality. Then we have colorectal surgeons, because it involves the bowel many times. We have a urologist. It can involve the bladder, kidney. ureters. We have psychologists and psychiatrists to deal with the mental aspect of it. Physiotherapists to help with recovery of the pelvis after such an intervention. Specialist nurses, pain specialists. We have some interventional pain specialists as well. Gastroenterologists. So this is called an endometriosis multidisciplinary team. So we have Third Park Hospital here in Nairobi, which is actually now having the full complement of this endometriosis multidisciplinary team.
Oh, Third Park. That's on Limuru Road.
In Third Parklands.
Parklands, yes. I love how they name them. Third Parklands. Thank you very much, Doc. And of course to Stella, thank you very much for the courage to share your story. So you can imagine all of the hugs now you're going to be receiving from your friends. We didn't know. You know how it is. So thank you very much for being that endo warrior, because I can when I hear your story and think about all of the young girls who probably don't understand what's going on, just like the doctor said, you're being told don't be such a sissy because of the pain, and you coming out to share your story, that's very monumental.
Thank you, Calvin. Thank you for having me.
Anytime, always here for a good cause.